Learning anatomy at first is like learning a foreign language. There are lots of new words, lots of Latin and foreign terms, but we have to learn these terms so that we can describe the body correctly. For example, a patient come in with a cut. How are you going to report that to the doctor? This patient here has a cut on her body. Excuse me, where? So you need to be specific as you describe the wound. That's why we are going to learn these different terms that we will use to describe different parts of the body. For example, we call chest a thoracic, and the neck is cervic or cervical. Be careful with these terms. Cervic is a neck. Cervix, which is the end part of the uterus and the beginning of the vagina. You see, cervic is totally different from cervix. I'm not too picky with spelling on your lab practical, but if I ask you to identify the neck and you tell me it's the cervix, you get it wrong because those two have different meaning. All right, so why do you have to learn these terms, you asked? Let's say a patient bumped the back of his head. You would report that the patient injury is to the occipital region. You see the difference between back of the head versus occipital region. Sometimes the healthcare setting is extremely busy and you don't want to write a paragraph to describe where the wound is. I will not spend the time to go over every one of these terms. You will have plenty of practice with these terms in your lab activities. Just make sure that you know these terms. We will use them over and over again throughout the entire class. I will use these terms a lot. If you don't know what they are, it's kind of like I'm speaking a foreign language to you. A lot of these terms are used to refer to other structures. For example, for the thigh region, let's go back here. Okay, so for the thigh region, right? We call this the femoral region. And as you go through other structures, things like bone at this femoral region here, you call it a femur. A muscle at the femoral region is a femoris. And we also have a femoral vein, femoral artery, and femoral nerve. You see how just learning the term femoral, you just learned the terms of so many more things. By learning these terms, your life will be so much easier. And trust me, it will be a nightmare for you to learn the bones and muscles and blood vessels and nerve if you don't know these terms. Now, let's talk about body cavities. Within our body, many organs are suspended in a cavity and drowned in fluid. There are two main cavities, the dorsal and ventral. Dorsal refers to the back and ventral refers to the front. Sometimes with dorsal, we also call it posterior, and ventral, we call that the anterior. The dorsal cavity contains the cranial cavity and the spinal cavity. The cranial cavity has your skull, and inside of the skull, you have your brain. The spinal cavity contains your spine and the spinal cord. These two cavities are surrounded by cerebral spinal fluid, or CSF. The ventral cavity, on the other hand, is subdivided into many other cavities. Inside of the ventral cavity, you have the thoracic cavity and the abdominal pelvic cavity. Note that the terms that we used. On the previous slide, you learned that the chest is the thoracic. And there you go, you got your thoracic cavity. We also learned that the abdomen, which is the belly part, and the pelvic region is the location where it holds reproductive organs. So if you combine the words, you get the abdominal pelvic cavity. Once again, the body region terms that I asked you to learn is totally reusable. Anatomists aren't exactly that creative. They often combine words and call them new words. So if you learned the terms that I asked you earlier, you understand fancy words like a master in the later chapters. Anyways, let's look at the thoracic cavity first. Inside of the thoracic cavity, you have the pleural cavity that contains your lungs. You have the mediastinum cavity in between your lungs, and inside of that, inside of this cavity, you have another cavity called the pericardial cavity, which has your heart in it. In terms of the abdominal pelvic cavity, you have the abdominal and pelvic cavity, of course. You have majority of your digestive organs in your abdominal cavity, and the reproductive organs are inside of your pelvic cavity. Things like the ovaries kind of thing. Okay, this slide here is for your reference. It has all the things that I already said. On the exam, you are expected to tell me which cavity is which and what organs can you find in each cavity. Now let's look at membranes. Membranes are flat sheets that cover or line part of the body. Think about organs being held in a bag inside of its specific cavity. There are 4 major types of membranes in your body. The cutaneous membrane is another name for the skin that covers your outer body. The synovial membranes are found in joints, versus mucous membranes. They line the cavities that are open to the exterior, such as the respiratory, urinary, digestive, and reproductive pathways. This is because as food go through your digestive tract, it doesn't mean that it's inside of your body. The things you ate are not inside of you until you absorb them into your bloodstream. Same with the respiratory system. You breathe in some air, but that air are not exactly in your body yet until you get those air into your bloodstream. The other type of membrane is serous membranes, which are extremely thin. They are double layer membranes that cover the walls of the organs and in the thoracic, and they are in the thoracic and abdominal pelvic cavities. Here's a close-up of the serous membranes. All organs that you see in the thoracic cavity and the abdominal pelvic cavity will cover in serous membranes. These membranes has two layers, the parietal layer and the visceral layer. Visceral means that this is the inside layer that touches the organ itself, which in this case you can see it's this layer right here. The parietal layer is the outer layer of the membrane that touches the wall of the cavity. You can think of it as you're punching a balloon. The balloon layer that touches your hand is the visceral layer, and the outer layer that you can touch with the other hand is the parietal layer. Another thing, between the parietal and the visceral layers is it's a very thin fluid fill space, which is the space in between here. It provides cushioning and a frictioning-free environment for organs that move around a lot. Something like the heart, the lungs, stomach, and the intestines. For example, the heart pumps, right? And as the heart pumps, it's prone to injury as it may get scratched up by the wall of the chest. With the serous fluid, it can help prevent friction as the heart move around or pump. The serous membranes is not only with the thoracic cavity as mentioned, there's also around the abdominal region. So around, if you have these serous membranes wrap around the lungs, then you call those the pleural membrane. If that membrane wraps around the heart, then you call that the pericardial membrane. But if you have these serous membranes and it wraps around your digestive organs, then it has a little bit more special name. It's called the peritoneum. It wraps around your digestive organs. With these body cavities, we can further divide them up into quadrants. Basically divided your abdominal pelvic cavity into 4 sections. How this is used? Let me tell you. For example, when a patient tell you they have pain, right? They say maybe the pain is right here. Are you going to tell your doctor, hey doctor, this guy has pain right here as well? Well, no, right? The doctor probably going to give you a what the heck face. Plus, how are you going to record that on paper? You're going to say right here as the pain location? Obviously not. Instead, you would say the patient has right lower quadrant pain. This location then can give the doctor an idea of what organ should have more attention. In this case, in the right lower quadrant, we should be more concerned with the appendix. This patient could potentially have appendicitis, which is an infection of the appendix. On the other hand, if a patient described the pain at right upper quadrant, then you would be more concerned with the liver and the gallbladder. For example, pain at the left upper quadrant would likely to be associated with the stomach and the spleen, which is behind that. And pain of the left lower quadrant associate with left side of the intestines, for example. Though we used quadrants to specify locations on the body, we can be even more specific. For example, a patient come in with a cut on his arm. How are you going to report that on paper? You can't just say the cut is on the arm. Where exactly on the arm? Here? Or here? Or here? Or here? They're all part of the arm, but where? So we use directional terms to be specific with our anatomy language. Okay, so let's say, for example, if the cut is here, then you would say the wound is proximal to the antecubital region, or the wound is distal to the acromial. Proximal means close to, and distal means away from. Antecubital and acromial are also body regions that I asked you to learn. Antecubital means the front of the elbow, and the acromial means the shoulder. Right? So here's the antecubital, here's the acromial. If you want to use the term proximal, then you have to say proximal to the antecubital. Because compared to the antecubital here, the wound is closer to the body or closer to the head compared to the antecubital. That's why you use the term proximal. If you want to use the term distal, then you have to say distal to the acromial. Because if you compare to the shoulder or the acromial here, the wound is definitely further away from the body or the head. There are also terms like lateral and medial. Lateral means to the side of, and medial means toward the middle. For example, your eyes are lateral to your nose, or the breast is medial to the arm, right? We also have terms like superior and inferior. Superior means above and inferior means below. For example, the nose is above the mouth and the eyes are inferior to the eyebrows. We also have superficial and deep. Right? Superficial refers to toward the outside world, and deep is toward the inside of the body. For example, the skin is superficial to muscles versus bones or deep to muscles. Just one important note, we only use proximal and distal for limbs. So upper and lower limbs or arms and legs. We only use superior and inferior for the trunk and the face. Right, now let's talk about body sections. As horrible as it sounds, this means how do you want to cut this person up? Do you want to make a cut that divides the body in half, the left and the right? Then we gotta make a sagittal cut. do you want to divide the person in front and back section? Then we probably want to make a frontal or coronal cut. What about cutting this person in the top and the bottom half? Then we gotta make a transverse cut. These cuts, or the way that we refer to the body sections, isn't just about cutting a person. When you send someone to a CT scan, for example, the radiologist would ask you, how do you want the pictures taken? If you want to see both the patient lungs, then you probably want the picture to be to be cut in a frontal plane so that it can look something like this, for example. Okay? This way you can see both the lungs, the left lung and the right lung. So dividing the front and the back. Or if you want to see, the inside of the organs, you can make a sagittal cut that divides the structure in the left and right. So just divide the person in half, right in the middle. Or a transverse cut, if you want to take even a closer look at the inside of certain organs. These cuts basically make a cut in the top and the bottom section in half. These cuts don't have to be about cutting the whole person, the whole body. For example, if I'm a surgeon and I want to make some cuts on this girl's arm, for example, I can make a sagittal cut. I can make a sagittal cut like that on the arm, because it divides the arm into the left and the right section. Or if something really bad happened and I really need to amputate her whole arm, then I would make a transverse cut like that.